Macrodantin, also known as nitrofurantoin, is a medication used to treat or prevent certain urinary tract infections. It is an antibiotic that works by stopping the growth of bacteria. It's important to note that macrodantin will not work for viral infections such as the common cold or flu. It's also important to avoid unnecessary use or overuse of this antibiotic, as it can lead to decreased effectiveness. It's important to note that macrodantin should not be used by children less than 1 month of age due to the risk of a certain blood problem called hemolytic anemia. The typical daily dosage for urinary tract infections is 50 to 100 mg 4 times a day. It's best to take macrodantin with food or milk to help prevent stomach upset, and it's important to take it at evenly spaced intervals throughout the day. Be sure to take the full prescribed amount of macrodantin even if you start to feel better, and consult with your doctor about the best timing for your individual situation. When taking macrodantin, it's important to follow your doctor's instructions. Usually, you'll take this medication 4 times a day to treat an infection, or once a day at bedtime to prevent infections. Make sure to swallow the medication whole and with food or milk. Avoid using antacids that contain magnesium trisilicate, as they can interfere with the absorption of macrodantin. The dosage and duration of treatment will depend on your medical condition and how you respond to the therapy. If you're giving this medication to a child, the dosage will also be based on their body weight. For the best results, take this antibiotic at the same times every day. This will help you remember to take it and ensure that it's effective. If you're using macrodantin to prevent infection, be sure to take it exactly as directed by your doctor. Don't skip doses or stop taking it without their approval. If you notice any signs of a new urinary tract infection, such as pain while urinating, contact your doctor. If you're using macrodantin to treat an infection, continue taking it until you've finished the full prescribed amount, even if your symptoms improve before then. Stopping the medication too early could cause the infection to return. And as always, inform your doctor if your condition doesn't improve or gets worse. If you experience nausea, vomiting, loss of appetite, or headache while taking macrodantin, try taking it with food to help reduce nausea. If any of these side effects persist or worsen, contact your doctor or pharmacist. Macrodantin may cause your urine to turn dark yellow or brown, but this is harmless and will go away when you stop taking the medication. Remember, your doctor has prescribed this medication because they believe the benefits outweigh the risks. Many people using macrodantin do not experience serious side effects. However, macrodantin may rarely cause very serious lung problems. If you experience symptoms such as cough that doesn't go away, chest pain, or trouble breathing, seek medical help immediately. Additionally, this drug may rarely cause serious liver, blood, or nerve problems. Contact your doctor if you notice symptoms such as nausea, unusual tiredness, or numbness/tingling of the arms/legs. In some cases, macrodantin may lead to a severe intestinal condition. If you develop symptoms like persistent diarrhea or abdominal pain, contact your doctor immediately. Prolonged use of macrodantin may also result in oral thrush or a new vaginal yeast infection. Contact your doctor if you notice any new symptoms. While rare, a serious allergic reaction to macrodantin can occur. Seek medical help if you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you experience any other effects, contact your doctor or pharmacist for further information. Before taking macrodantin, make sure to inform your doctor or pharmacist about any allergies you may have, as this medication may contain inactive ingredients that can cause allergic reactions. It's important to discuss your medical history, especially if you have kidney or liver disease, certain genetic conditions, blood disorders, lung diseases, nerve problems, eye diseases, diabetes, untreated mineral imbalance, or vitamin B deficiency. It's important to note that macrodantin may affect the effectiveness of live bacterial vaccines, so be sure to inform your healthcare professional if you are using this medication before receiving any immunizations or vaccinations. Older adults may be more susceptible to side effects, particularly nerve, liver, or lung problems while using this drug. If you are pregnant, macrodantin should only be used when necessary, and should not be used near or at the time of delivery due to potential harm to the newborn. It's essential to discuss the risks and benefits with your doctor. Additionally, this medication can pass into breast milk and may have adverse effects on nursing infants, so consult your doctor before breastfeeding. When taking Macrodantin, it's important to be aware of potential drug interactions that can affect how the medication works or increase the risk of serious side effects. Always keep a list of all the medications and herbal products you use and share it with your doctor and pharmacist. Do not change the dosage of any medicines without your doctor's approval. It's important to note that Macrodantin may interact with a medication called sulfenpyrazone. Additionally, this medication may interfere with certain lab tests, potentially causing false results. Make sure to inform lab personnel and all your doctors that you are taking Macrodantin. As for the best time to take this medication, it is typically recommended to take it with food to help reduce the risk of stomach upset. The dosage and frequency of Macrodantin will be determined by your doctor based on your medical condition and response to treatment. Be sure to follow your doctor's instructions and take the medication exactly as prescribed for the best results. If someone has taken too much Macrodantin and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It's important not to share Macrodantin with others, as it has been prescribed specifically for your current condition. It's not recommended to use it later for another infection unless your doctor advises you to do so. While taking this medication, you may need to undergo lab and/or medical tests, such as complete blood counts, tests for kidney and liver function, and urine cultures. It's essential to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. When it comes to storing Macrodantin, it's important to keep it at room temperature and away from light and moisture. It's best to avoid storing it in the bathroom, and always make sure to keep it out of reach of children and pets. When it comes to getting rid of Macrodantin, it's important not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, it's best to properly dispose of the product when it's expired or no longer needed. To do this, it's recommended to consult with your pharmacist or local waste disposal company for the best way to discard it. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.